Hi, I'm Dr. Thomas Lee Dodson, DMD, Family and Cosmetic Dentistry in Roswell, Georgia. My office address is 1405 Old Alabama Road, and the zip code is 30076. I've been practicing dentistry in Roswell for 33 years, and I actually attended Roswell High School in the early 70s, so I've been in Roswell for quite a long time. So I hope you'll enjoy these videos. We put these together to help you with some commonly asked questions. And again, if you would like to reach our office to make an appointment, call us at 770-992-5779, or you can go for more information at our website, which is www.drdodson.com. That's DRDODSON.com. Thank you. Many people that come into our practice are interested in cosmetic dentistry procedures. Cosmetic dentistry is a giant catch-all for a lot of different procedures. And I'll talk about some of those procedures that we do in our office. The very simplest cosmetic procedure that we do would be dental whitening. Many people like their teeth, except for the fact they think they might not be white enough. So we have dental whitening, or sometimes known as dental bleaching. Terrific procedure, simple. Most of it is done at home, and within a few weeks your teeth are many, many shades whiter. Patients love that, and that's considered a cosmetic procedure. It makes your teeth look better, makes you feel better about your teeth. The next simplest cosmetic procedure we do is known as dental bonding. A lot of people have heard the term dental bonding and are a little bit unclear about what that means. One of the materials that we have available to us in dentistry is called dental composite. It's a white filling material. I say white, it's a tooth-colored filling material. We have many, many shades of composite so that we can match your tooth exactly. So if there's a discrepancy in the shape of the tooth, we can use the composite material and the super duper bonding materials that we have now to actually create a new shape of your tooth. It's like dental sculpting. We apply the material on there in a putty form, shape it, cure it, and then shape it again with the shaping instruments, polish it, and it looks just like a tooth. No, you can't tell where the tooth ends and the bonding begins. And with that procedure, we're able to make great changes in the shape and contour of your teeth, and in many cases, that's the only procedure necessary to really improve your smile. And very often we'll combine that with the bleaching. We'll do the bleaching first, and then we'll match the new bleach shade with the bonding and give you a very, very beautiful smile with minimal cost and minimal invasiveness. We also use the bonding in a case, it's called a diastema. Sometimes people have a space between their front teeth that they're unhappy with. There's space between any of their teeth, but the front teeth are the most common, obviously. We can use that bonding to close that space and get terrific results with that. People are very happy with that. I guess the next level would be porcelain veneers. Porcelain veneers are a shell of porcelain that's been shaped by the laboratory, and with minimal preparation of your teeth, these veneers are bonded onto the fronts of your teeth to create a very, very beautiful smile with the ideal shape and color. People love those. We do a lot of those. Those are very nice. The next step from that would be crowns. Very often the teeth in the front are either so misaligned or so broken down from previous fillings or cavities that we have no choice but to actually crown the teeth. In our office, when we do front teeth, we use only all porcelain crowns, no metal, People are very worried when they hear the word crown for their front teeth. They worry about the black mark above their teeth. I hear that a lot. People are worried about having that black mark above their crown at their gum line. With the all porcelain crowns, there is no metal, there is no black mark. They blend exactly into your tooth. Nobody will know you have crowns. They're beautiful, they're lifelike. They are a little more invasive than the veneers because we have to take off a little more of your tooth, but not that much. I mean, most of your tooth is still there, but we do have to remove enough for the crown to fit over your tooth. You can do the crowns or the veneers as far back as you want. Many people are okay with just 4, sometimes 6. Sometimes we even go as far as 10, 5 on each side. Whatever it takes to make your smile look like you want it, that's what we're able to do. Many times cosmetic needs are caused by missing teeth. In years past, up until I'd say the last 10 years, if you had a missing tooth, a dental bridge was the only alternative to replace that missing tooth, and that meant preparing the teeth on either side of the missing tooth and putting in crowns to retain the bridge, and it was a pretty involved process. Today, we're lucky enough to have implants, and dental implants allow us to replace a missing tooth without touching the teeth on either side of the space. The surgeon places the implant into the missing spot, and then I will place a porcelain crown on that implant that looks exactly like the tooth that's gone, and people won't know you ever lost a tooth there. It's a beautiful procedure, and we've had many, many compliments on that. People love that. If you're missing more than one tooth, occasionally people are missing all their teeth. And in that case, then you get into what's called dentures, where you have a full or partial plate with teeth on it to replace all of your missing teeth. That can either be suction retained or implant retained. We're going more and more to the implant retained now, which allows you to snap that denture into place, and they're very lifelike. Nobody knows it's there. They're beautiful. In fact, using a denture, we can actually create the most ideal smile of all because we have no restrictions from your other teeth or gums. We can make actually an ideal smile using a denture. So if you feel like you need a denture, don't be afraid. It's going to be beautiful, and you're going to love the result. Another cosmetic procedure that we do in our office is that we only use white filling material. We don't use any more of the silver amalgam material that was the workhorse in dentistry for so many years. So when you have a filling that needs to be done in our office, it will always be white, even if you've had a silver filling in your tooth before. It's amazing the transition. If you lose a couple of silver fillings and replace them with white fillings, suddenly your whole smile brightens up. It's amazing how much that changes your smile. So we don't do amalgam anymore. If you get a filling in our office, it will be white. Thank you for watching this video. I hope it turned out to be informative for you. These are some topics that we found patients commonly have questions in. So again, if you'd like to reach our office to make an appointment, our phone number is 770-992-5779. And our website is www.drdodson.com. Thank you again, and I hope this helped you.